My name is Dr. Robert Glansman, Chief Medical Officer of Clean Nanomedicine. On behalf of Clean, the investigators, and the patients and their families, it is my great pleasure to present to you RESCUE-ALS. RESCUE-ALS is a double-blind, placebo-controlled phase 2 study of one dose of CNM-Au8 versus placebo in slowing ALS disease progression as assessed by electromyography changes in early symptomatic ALS patients who are on stable background therapy. Patients are randomized 1-to-1 to receive either 30 milligrams of CNM-Au8 or matching placebo daily. There's a 36-week double-blind treatment period with open-label extension to follow. Primary endpoint is change in Munich 4 score, which is the mean change in the average Munich values for the adductor digiti minimi, abductor pollicis brevis, biceps brachii, and tibialis anterior muscles. CNM-Au8 is an aqueous suspension of clean-surfaced, faceted gold nanocrystals, which are orally administered, blood-brain barrier penetrant, and exhibit no adverse effect levels in extensive preclinical toxicology studies. The mechanism of action of CNM-Au8 is to provide bioenergetic catalytic support to neurons and glia, as well as to directly reduce reactive oxygen species and promote protein homeostasis through the heat shock 1 protein pathway. Baseline demographics are provided here on slide 2, which are typical for an early ALS population. Mean time from diagnosis is less than 6 months, with nearly all patients currently on riluzole. Mean ALS FRSR scores at baseline are approximately 38 to 39, meaning that there is impairment in these patients. However, the forced vital capacity, the mean forced vital capacity is approximately 80%, meaning that these patients are stable. In the lower right panel, you can see the study schematic, along with the primary and key secondary endpoints, as well as exploratory endpoints, including ALS FRSR scores, as well as forced vital capacity, and the ALS specific quality of life scale. On slide 3, we see blinded interim data for the population, demonstrating mean Munich 4 improvements or stability in approximately 50% of enrolled subjects. Also presented are split hand index data, as well as absolute change in the ALS FRSR scores from baseline to week 36. Consistency in these data are demonstrated by significant correlation between the Munich 4 score and absolute change in ALS FRSR based on regression analysis with an R-squared value of approximately 0.4. In summary, these preliminary blinded efficacy data from the RESCUE-ALS phase 2 placebo-controlled trial demonstrated disease-modifying potential for CNM-Au8 in the treatment of ALS. Thank you for your attention.